Initially, the treatment that I had was a radical hysterectomy, which I had 5 weeks after after the MRI scan.
And 4 weeks to the day after the keyhole surgery, I went back into hospital and I had the hysterectomy, which was horrific. It's incredibly painful. It's amazing. You suddenly learn how much your body uses your stomach muscles. I'd had them cut through. I had quite strong stomach muscles. I ride horses. My core strength was quite good. But suddenly they've all been cut, and sneezing, and I'd burst into tears because, ow, that uses your stomach. You tense for it. It's a hard operation to sort of go through and recover from. And it's a hard thing to be dealing with at 25 and single. I'd always wanted children, and suddenly that just wasn't even an option. I didn't have a choice. I had to have this surgery. In the meantime, there's some horrible decisions you have to make. There are scenarios I never expected to be put into at that age. I was sent to a family planning clinic to discuss whether I wanted to freeze eggs. I just couldn't really comprehend that decision. I was 25 and single. Yes, I wanted kids, but I wasn't close to thinking about having kids. So to be making decisions about how I'm going to feel about kids in the future, and did I want to use donor sperm to have them fertilised because that's better odds of them surviving. I just thought, God, I can't make these decisions on my own right now. I chose not to have anything frozen. I was fortunate that they were able to leave my ovaries in. They should stay working. Surrogacy may be an option in the future. But it was just amazing being put in the position of, right, here's a decision to make. How do you feel about it? I don't know. And I just sat there amazed, really, at the decisions I was faced with making.
What happens is when they take away the tumour, they also take away tissue, healthy tissue around the tumour. And to be clear, you have to have, when what they do is they send it away to a path lab. The path lab then looks, and the tissue on the very edge of where they've taken away the cancer has to be clear and not have any evidence of any cancer cells. Unfortunately for me, when they did that at the path lab, there was evidence of spread to the outer edge, which meant I had to have additional treatment. My consultant told me that I'd need to have 5 weeks of radiotherapy around the area. After that was 6 weekly checkups. After about 8 months, the consultant this time felt something that, if in his words, was something that just doesn't feel quite right, something that's a bit mysterious, and that he wanted to have further investigation on, which he did, again with an MRI scan and another examination under anaesthetic. And unfortunately for me, I had a recurrence of the cervical cancer that had started growing another tumour in a similar area to where I'd had the first. From then, I had further radical surgery, which was a pelvic exenteration. The sort of slang term for it is a pelvic clearance, which gives you an indication of what the actual surgery is, involving the removal of pretty much everything in my pelvic area, which included, for me, my womb had already gone anyway in my hysterectomy. It involved taking the top half of my vagina, my ovaries, which had been left because my consultant had left my ovaries when I'd had the radical hysterectomy because of my age, to try and stop me from having hot flushes and going through the menopause, because of course that brings its own problems. But they had died during the radiotherapy. So I had my ovaries removed, I had my bladder removed, and I had a section of my bowel removed, and pretty much anything else that was left in there to try and get rid of the cancer.